The impact program means an exciting new partnership for these institutions. It's taking the #1 most innovative university in the country and the #1 health system in the country and bringing them together to really define the future of health technology.
For Mayo Clinic and ASU, the impact program is really the first bridge joint program offering that's focused on medical innovation and teaching future innovators how to change the world.
So it's a needs-based, patient-centered innovation where solutions are made by students from ASU, but jointly in collaboration with Mayo.
I realized impact was different as soon as I started hearing the speakers come into my class. They seemed so passionate about the subject and really wanted our students to thrive.
By doing the impact program, I'm able to understand a little bit more about what the healthcare industry wants. What innovations are they looking for, and how do physicians think when they're adopting new things into their work and into their practice?
One experience in my clinical immersion that really helped me was just being around the patients, just talking to them. You can get a lot of what's going on in their lives and what they struggle with. And with innovation, you really want to make sure that what you work on targets what the patients need more than anything.
I love problem solving, I love helping people, and I find it incredibly valuable to take the biological and disease state knowledge behind all these problems and use that to engineer a solution that's going to be useful and truly implemented into real practices.
With clinical immersion, we directly got to sit in with patients, doctors, and observe real-life encounters where we could identify problems.
So today we were presenting at Giants Among Us. We've spent 120 hours clinically immersed in Mayo Clinic in Arizona, and we have identified a variety of needs within within the healthcare system. We have narrowed it down to 3. And so we were presenting today, getting feedback on those top 3s and seeing which one is the most viable for us to continue forward in this program.
If you are somebody who wants to make a difference in healthcare, and maybe you just don't know how yet, this is a great place to start because it gives you the perspective and the tools that you need to really be an influential change maker.
This program makes you think and get to the root of the problem through observations and just hands-on experience. So that's what made it different.
We would really like to welcome students from all sorts of backgrounds, whether it's engineering or business or a clinical need, to come together in our program to form diverse teams so that we can bring different areas together to solve real-world problems. And through that, we'll form a strength that we won't do with engineering alone.